Hundreds of people are dying in London. Most believe it's caused by bad air. One doctor thought otherwise. It's 1854. London is one of the fastest growing cities in the world, but it's also one of the dirtiest. Raw sewage flows through the streets, contaminates the city's water supply, and people begin dying, and I mean fast. Entire families are struck with severe diarrhea and dehydration, some dying within days, and no one really knows why. At the time, most people believed that diseases like cholera spread through miasma, which is bad air. But one physician just was not convinced. Dr. John Snow believed something else was making people sick. So instead of guessing, Snow started to investigate and ask questions. Where did the people live that became sick? Where did they get their water from? Who wasn't getting sick? He began to plot each death on a map, and he noticed a pattern. Nearly every death was clustered around one public health water pump on Broad Street. And then he found something even more convincing. A nearby brewery had almost no cases of cholera. Why? Well, because the workers were drinking beer instead of water. And a nearby workhouse also had very little cases of cholera, and that's because they had their own private well. The evidence was evidencing, if you will. It pointed to one conclusion. It was the water, not the air, that was spreading the disease. So Snow presented his findings to local officials. They removed the handle from Broad Street water pump. Without access to the contaminated water, outbreaks dramatically slowed. Although scientists wouldn't fully understand cholera bacteria for years, John Snow had demonstrated the power of careful observation and data. That investigation became the foundation of modern epidemiology. Today, when public health professionals investigate foodborne illnesses, trace outbreaks, map disease patterns, or respond to emerging infections, they're following the same principles John Snow used over 170 years ago. One neighborhood, one map, one water pump, and one investigation that changed public health forever. Sometimes the most powerful tool in public health isn't medicine. Sometimes it's just asking the right questions. Ain't that some shit?